Attention Deficit Hyperactivity Disorder, or ADHD, is a neurodevelopmental disorder characterized by a persistent pattern of inattention and or hyperactivity impulsivity that interferes with functioning or development. The disorder is defined by three core symptom domains. Inattention includes difficulty sustaining focus, being easily distracted, making careless mistakes, being forgetful in daily activities, and appearing not to listen. Hyperactivity involves fidgeting, leaving a seat inappropriately, running or climbing excessively, feeling on the go, and talking excessively. Impulsivity is characterized by blurting out answers, having difficulty waiting for turns, and interrupting or intruding on others. ADHD has three presentation types. Combined presentation meets the criteria for both inattention and hyperactivity impulsivity. Predominantly inattentive presentation meets the criteria for inattention, but not for hyperactivity impulsivity. This was formerly called attention deficit disorder. Predominantly hyperactive impulsive presentation meets the criteria for hyperactivity impulsivity, but not for inattention, and this presentation is rare in adults. The causes and neurobiology of ADHD involve several factors. There is a strong genetic component, making it highly heritable. Neurobiological research points to dysregulation of neurotransmitter systems, particularly dopamine and norepinephrine, in the brain networks responsible for executive function. Brain structure differences are also observed, particularly in the prefrontal cortex, which governs planning, focus, and impulse control. Diagnosis is based on specific criteria from the DSM-5. These include having several symptoms present before age 12. Symptoms present in two or more settings, such as home, work, or school. Clear evidence that the symptoms interfere with social, academic, or occupational functioning. And ensuring the symptoms are not better explained by another mental disorder. Evidence-based treatments are multifaceted. Stimulant medications are considered first-line treatment. These include methylphenidate-based medications, such as Ritalin and Concerta, and amphetamine-based medications, such as Adderall and Vyvanse. They work by increasing dopamine and norepinephrine in the prefrontal cortex. Non-stimulant medications are also used, including atomoxetine, also known as Strattera, which is a selective norepinephrine reuptake inhibitor, and guanfacine, known as Inattentive, and clonidine, known as Capve, which are alpha-2 agonists that improve emotional regulation and focus. Behavioral therapy and coaching are crucial as they teach organizational skills, time management, and coping strategies. ADHD has a lifelong impact but is also associated with certain strengths. If left untreated, it can lead to academic underachievement, low self-esteem, relationship difficulties, and an increased risk of accidents. However, individuals with ADHD are often associated with creativity, high energy, hyperfocus on interests, and strong problem-solving skills. If you found this video helpful, don't forget to like, share, and subscribe for more informative content. Stay tuned for our next video.